When you have fewer than 6 months to live, your MD Anderson Cancer Center care team may recommend a transition out of the hospital and into hospice care. A case manager and social worker will help you with this transition. The goal of hospice care is to make this next phase of your life as comfortable and meaningful as possible. Hospice care typically includes pain management, spiritual support, and emotional support for you and your loved ones. You will no longer receive medical care to treat your cancer. Choosing a hospice agency is a personal decision and depends on your health needs and values. Finding the agency that you are most comfortable with is important. When you are ready, your case manager will bring you a list of potential agencies that can best meet your needs. You can receive hospice care in an inpatient facility or in your home. MD Anderson does not offer inpatient hospice care. Inpatient hospice staff are able to manage pain or other symptoms that cannot be managed at home. If you choose to get hospice care at home, you will need to have family or friends with you throughout the day and night. It is important for you to create a schedule in advance. Hospice nurses will come to your home on a regular basis, but they will not be able to spend 24 hours a day with you. When you have decided on 2 or 3 agencies, your case manager will reach out to the hospice representative to visit with you and your family. They will explain the services they offer. Once you choose a hospice agency, your MD Anderson care team will start transitioning your care to the hospice agency. You will meet with your hospice agency and be introduced to your new care team. The hospice agency will become your primary contact for any needs. Once you're in hospice, MD Anderson will no longer provide you with medical care. Any future appointments at MD Anderson will be canceled. This includes appointments for treatments or procedures such as radiation therapy or blood transfusions. Your hospice doctor will oversee all of your medical needs, including medicines. The hospice team may also include nurses, case managers, social workers, chaplains, and volunteers. The transition to hospice can feel overwhelming. The hospice team members are there to help you with this transition. Here are some tips to consider as you leave the hospital for hospice care. It's okay to not be okay. This is hard. It is important to acknowledge your emotions and talk to someone about how you are feeling. The hospice nurse and social worker can help you and your family. This is a period of uncertainty. Focus on what you can control. Establish a daily routine. Be kind to yourself as you go through this transition. Remember to take care of yourself. Every day, try to do one thing for yourself, even if it's just for 5 minutes. Enjoy the moments of connection with your loved ones. You may exhibit symptoms during your final days, which could be difficult for your loved ones to see. Contact the hospice agency for guidance if your caregivers have any questions about new or worsening symptoms. Going to the acute cancer care center at MD Anderson should be the last resort if the hospice agency is not meeting your needs. If hospice is not the right decision for you, you can end or revoke your hospice service at any time. If you do, you will need to return to MD Anderson for your care. If you have any questions about hospice, reach out to your MD Anderson case manager or social work counselor.